What is autism? Autism क्या है?
Autism, now called Autism Spectrum Disorder, ASD, DSM-5-TR, 2022. It is a neurodevelopmental disorder. ASD is a developmental disability caused by differences in your child's brain. People with ASD may behave, interact and learn in ways that are different from other people. They may have trouble with social interactions and with interpreting and using nonverbal and verbal communication. Researchers believe ASD is a disorder of very early brain development. The behavioral signs of autism characteristics typically surface between the ages of 1.5 and 3 years old.
Now we would learn the symptoms of autism. Autism के क्या लक्षण हैं?
Difficulties interacting with other people or differences in how they interact with others. Trouble using and understanding nonverbal communication, like eye contact, gestures and facial expressions. Delayed or absent language development. Trouble forming and understanding relationships. Repetitive motor behaviors, like flapping arms, body rocking are repetitive speech or play. Insistence on sameness in environment or routine. Intense or unusual interests. Sensory aversions, like dislike of loud noises, or sensory-seeking behaviors. Signs of autism include difficulties with social interactions, such as your child doesn't look at you when you call their name or responds inconsistently. Your baby doesn't smile widely or make warm, joyful expressions by the age of 6 months. Your baby doesn't engage in smiling, making sounds and making faces with you or other people by the age of 9 months. Your baby doesn't babble by the age of 12 months. Your baby doesn't use gestures such as reaching or waving by the age of 12 months. Your baby doesn't play any back and forth games, like peek-a-boo, by the age of 12 months. Your toddler doesn't say any words by the age of 16 months. Your toddler doesn't speak any meaningful, two-word phrases, not including imitating or repeating, by the age of 24 months. Any loss of speech, babbling or social skills. Signs of autism also include specific behaviors, called restricted or repetitive behaviors or interests. Your child often lines up toys or plays with toys the same way every time. Your child has obsessive or very unusual interests. Your child has significant sensory aversions, like dislike of loud noises, dislike of how certain clothes fit or feel, or very picky eating. Your child has sensory-seeking behaviors, like looking out of the corner of their eye at objects, peering, sniffing or licking objects.
अब हम जानेंगे ऑटिज्म के कारण।
There's no clear-cut cause of ASD. Research supports genetic and environmental factors as some causes of autism. Scientists believe there could be many different causes of ASD that act together to change the ways people develop. Is autism genetic? Yes, genetics do play a role in autism. But healthcare providers have only identified specific genetic causes in 10% to 20% of cases. These cases include specific genetic syndromes associated with ASD, such as Fragile X syndrome, and rare changes in genetic code. Are siblings at greater risk for autism spectrum disorder, ASD? Autism is hereditary? When one child receives an ASD diagnosis, the next child has about a 20% greater risk of developing autism than normal. When the first two children in a family have ASD, the third child has about a 32% greater risk of developing ASD. Do vaccines cause autism, ASD? Many scientifically sound studies have proven that vaccines don't cause autism. When children suddenly show symptoms of ASD, some parents mistakenly blame a recent vaccination. No reliable study has found any proven link between childhood vaccination and autism. What are the risk factors for autism? This field of study is an active one for research. Current known risk factors for autism include birthing parent of age 35 or older, use of valproic acid or thalidomide by the birthing parent during pregnancy, premature labor and birth, complications during birth, low birth weight, having a sibling with autism, having certain chromosomal or genetic conditions. What are the complications of autism? A wide range of physical and mental conditions often come along with autism. These conditions may include feeding issues, poor sleep, gastrointestinal (GI) problems, epilepsy, attention deficit, hyperactivity disorder, ADHD, anxiety and depression. Other mental health conditions, such as obsessive compulsive disorder, OCD, schizophrenia and bipolar disorder.
Now question arises, is autism a disability?
Yes, healthcare providers classify autism as a disability. The Americans with Disabilities Act, ADA, protects people with autism spectrum disorder. Continue. Remaining part in next video. Dr. Sandeep K. Pandey.